Hi, my name is Dr. Kevin Crane, and I'd like to welcome you to Tulane's Center for Advanced Simulation and Team Training. And I'm the Director of Team Training at our center, which is an incredible facility that has been added to Tulane University's Health Sciences Center to advocate for patient safety, develop clinical skills, and really show how we can train physicians of the future using the safest methods in a team-based approach. This facility offers simulation activities which are ways of practicing clinical skills that would otherwise have to be practiced on real patients. This is a wonderful way that we can assure safety of patients, and we can also develop and build team skills in healthcare professionals across disciplines and across different types of providers as well. So we think that this is a wonderful opportunity for people within the region and other parts of the country who are coming to New Orleans. The city has much to offer and now has even more to offer. There are 4 functioning hospital patient rooms designed in a realistic setting to train for various standards of care for in-hospital patients and long-term care issues for ICU patients. Specific training is also available for hospital rapid response teams to practice teamwork and communication in an emergency situation utilizing 10 common code scenarios. The 4 doctors' office exam rooms are equipped to replicate a standard private physician office and can be used to train the staffs of physician groups or clinics on a variety of everyday procedures. In addition, office emergencies training can be done for the staff to allow practice time on the critical thinking and procedures needed in an acute emergency, which is rarely seen in a physician's office setting.
This is the emergency room, and it is the largest room in the simulation center. The rooms can be configured a variety of ways to train individuals on specific tasks used in emergency situations or train teams in critical thinking, decision-making, and communications. The environment can be set with a variety of patient simulators from neonate to adult, depending on the needs of the training. And the simulators can be programmed to cover a wide spectrum of specialties. The Labor and Delivery Suite can accommodate training for attendees or teams from obstetrics, gynecology, neonatal, or pediatrics. In addition to this large suite, the Sim Center has 2 simulated patients for child delivery with birthing beds, several gynecologic task trainers, a simulated neonatal patient, and a simulated pediatric patient.
Our simulated operating room comes as close to an actual operating room as possible in a simulated environment. It's completely equipped with all of the equipment that you would find in a normal surgical operating room in any hospital in the country. The operating room is most often used along with the Sim Center's high-fidelity adult and pediatric simulators. The simulators allow for training on dozens of procedures and are also the only simulators available that will recognize and respond to over 150 different pharmacologic drugs that can even be administered by IV. The control room allows groups utilizing the Sim Center to observe the live training that is taking place in any room. Controllable cameras and mics in every room allow every aspect of training to be observed and later discussed in a debriefing session. The control room allows instructors or facilitators to observe without interrupting or influencing the training experience. Reviewing recordings after the hands-on training is completed helps close the loop between training, the hands-on procedures, and the mind for critical thinking. 2 meeting rooms with a capacity of 32 participants in each room, or a combined capacity of 100, have built-in audiovisual components with ceiling-mounted screens and projectors, as well as speakers and microphones. Meeting space can be arranged lecture-style, conference-style, or any configuration needed. The video and audio recording that is possible in every room in the Sim Center also allows training sessions to be streamed live into the meeting rooms to help further the learning process. In addition, this web-based live streaming video can be taken a step further and can be set up to broadcast live to a remote hotel, convention meeting room, or trade show floor.
We hope you have seen that the Tulane Center for Advanced Medical Simulation and Team Training was built to a higher standard than most medical training facilities. The realistic environment, high-fidelity patient simulators, and hundreds of procedures that are possible, along with team and communication training, all come together to make the Tulane Sim Center a world-class training facility in a city renowned for hosting meetings and conferences of all sizes. We hope to welcome you to our city and our facility in the future.